So hello orthopods, welcome back to the channel again. Guide to orthopedic residency. So it's a day 2. So in the day 2, what I'm going to tell you is, so you're done with the dressing part. Now you have to move on. What you have to do after the dressing. So if you wake up at like 5:30, 6 o'clock or 7 o'clock, whatever is the time, okay, you have to finish your dressing within the 1 hour. After finishing the dressing part, then you have to move on to the round part, your R2 second year. So what happens ideally, I'm going to tell you what is an ideal case, what I have seen, what my senior used to do. Then I'll describe about my scenarios, what we used to see. Okay, the first thing is, after finishing the dressing, you have to take a round. Being a R1, you are still a doctor. Okay, you are still a doctor to the patients in your ward. You are an MBBS, MS orthopedician R1. Okay, there are hell lot of hierarchy. Okay, R2, R3, SR, AP, but still you are a doctor. First of all, be grateful that you are a doctor. Okay, then behave likely, behave according to that. Okay, now treat your patients like you are a doctor. Behave and express things, the things which are coming out of your mouth. Okay, that should be like you are actually a doctor. What happens in this during residency in the R1 setup, you behave like usually in the government setup, the poor patient comes to us and we behave in a very illiterate way. Actually, it's very frankly, we behave in a very illiterate way. So please don't do that. Okay, so we say that handle with care, and in a better term, I would suggest bring things out of your mind, out of your mouth, in a better way, in a polite way, in a smooth way. Okay, whatever you are going to speak, please speak in a smooth way. So go and take a round. Now this is the list of the things you have to check in your round. So number 1, if you are starting with the first patient, okay, that will be a clean patient. The clean here means, number 1, the clean here, he is a post-op patient. Okay, the clean patient is a post-op patient. Okay, post-op means post-operative patient. What we used to do, we used to arrange them in like, the first cot will be for the spine patient, the second cot will be for the replacement, third cot for the arthroscopy, the fourth cot for the trauma patient, and subsequently. Okay, now if there is a serious patient in your ward, you have to keep that patient near the oxygen line. Now the O2 lines, it depends upon the setups. Okay, there are sometimes the O2 lines are not there where you have kept the patient, the serious patient. Okay, so keep reserve cot for the serious patient. If in case the saturation goes down, like you have to give the O2 and the oxygen mask. So for that condition, keep a cot ready for that patient. Okay, on that cot, label it as this cot is for the serious patient, and you keep that serious patient on that cot only. Okay, if somebody gets serious, you shift that patient to that side. And if you are thinking, like if you are suspecting that this patient having a risk of something like in orthopedics, fat embolism, okay, so keep that patient to that cot only, na. Okay, reserve that cot for that patient only. And second thing is, after arranging the patient according to that, okay, second thing you have to do, you have to check their files. Okay, is there any pending investigation your seniors wants you to do? Now we all tend to forget. Now in today's era, what is life, what our life is like, it's just like an Instagram. We swipe the things, we swipe a post, We swipe a post, we see a new post, we forget about the last post. We swipe the new post, we forget about the last post. Whatever the emotional, whatever the motivational, inspirational, the bad, whatever the post it is, okay, we forget about it. So our life is like that, and in residency it is just like that. In the first year, like things are coming like from there, from anywhere, and you keep on forgetting. And for that thing, I'm asking you to do one more thing. Just keep a diary and take a note of whatever the pending work is. Okay, make a list of that. The pending work, the pending investigation, the pending dressing, the pending slabs. These are the basic works of you. The basic works you have to do is the investigation, the dressing, the slab. Okay, so just check the pending investigation. If you're done with the investigation part, or your colleague is done with the investigation part, then you check for the like any dressing. You are already done with the septic dressing part. Now, if in the clean part, look for any sockage. This sockage that will create a big impression. Now, if you have done the good dressing, everything is very good. But what will happen in case of rounds? If there is small socket, like drops of blood are oozing out, drops of your like betadine, or these things are like making the dressing wet, that will create a bad impression of yours. And after that, the next thing after the dressing sockage is you have to check the intracath. Okay, if the patient who is on IV line, okay, if he is on the IV line, check their intracath, whether it is in a good place, whether it is out or in. If the sister part, okay, so just for a second, keep all the things aside and focus on the sister part. Sisters don't put IV lines in the 90% of the government institutions. Okay, whoever is telling you कि मेरे यहाँ तो सिस्टर डालती है, मेरे यहाँ तो सिस्टर डालती है, इस इंस्टीट्यूशन में सिस्टर डालती है, ऐसा कहीं नहीं होता. ठीक है, residents or interns, they have to insert the IV line. If sister have asked you to कि इस patient का IC और catheter out है, so just go and do it first. Okay, otherwise that patient is going to complain in the rounds. And seriously, these patients actually complain in the rounds about this intracath कि मुझे तो ड्रग सुबह से गई नहीं है. When your seniors will ask the sister कि क्यों नहीं गया ड्रग, she like कि मैंने तो बोला था IC नहीं है, intracath नहीं है, और and then you are like मुझे बोला था या नहीं बोला था. अभी बोला गया होगा definitely, because sisters keep on changing. They have a fixed time of duration, fixed duration. They are not residents. उन्होंने बोला ही होगा आपको, and there is a hardly 1 to 2% of times they forget. The IC part, they never forget. The sisters never forget about the IC part. Okay, and if it is related, if anything is related to the residents, they never forget. So take care of that. And I guess that's enough for today. Okay, thank you.